Good day. I'm your student nurse RN Bruto, and I'm going to discuss Ebola virus disease. So, what is really Ebola virus disease? And what makes Ebola so dangerous? How can a virus overwhelm the very complex defense system of the body so quickly and so effectively? So, let's take a look at what Ebola does. Ebola virus. A virus is a very small thing, a bit of RNA or DNA, and a few proteins and hull. So it has no ability to do anything by itself or whatsoever, and can only survive and proliferate by infecting cells. To avoid this, we have the immune system. The immune system is super complex, so we develop a visual system that makes it easy to understand. So it looks like this. Let's concentrate on a part that is critical to understanding Ebola and ignore the rest. So usually, dendritic cells will activate the army of antivirus cells, support cells, and antibody factories that work together with the guard cells. Wipe out the infection in a matter of days, but when Ebola strikes, it directly attacks the immune system. Some of the first cells it takes over are the dendritic cells, the brains of the immune system. The Ebola virus enters a dendritic cells by binding into receptors for cell transport. So when it's inside, it dissolves its outer hulls and releases its genetic materials, nuclear proteins, and enzymes. In a nutshell, it takes over the cell, disables the cell's protective mechanisms, and reprograms it. So the cell now becomes a virus production machine and uses its resources to build Ebola viruses. So once the cell is saturated, it dissolves the cell membrane and millions of viruses are released into the tissue. The virus not only prevents the dendritic cells from activating the specialized and antivirus forces, it manipulates them into sending signal to protein that tricks specialized cells into ending their own lives prematurely. So the immune system is seriously disrupted and unable to react. So when the virus rapidly multiplies, we're talking billions. There are cells that should deal with infected cells. So the natural killer cells, but they also get infected and just die before they can prevent the disease from spreading. At the same time, Ebola infects the guard cells of the body, macrophages, and monocytes. Not only managing to circumvent their defenses, it also manipulates some to signal to the cells make up the blood vessels, telling it to release fluid into the body. And usually this makes sense. But in this case, it just causes mayhem. So all of the body's neutrophils are activated, awakened by the virus, and the macrophages signals then are not very effective against viruses and begin to do lots of stuff they shouldn't do. So the neutrophil signals to do the blood vessels to release more fluid, causing internal bleeding. So another area of the body Ebola attacks is the liver. So the virus finds it very easy to enter the liver and quickly starts killing loads of these liver cells and causing organ failure and more internal bleeding. And all of these things are going the same time. So as the virus spreads, it's like nukes exploding everywhere. So when an incident of this in one region will be problem enough, but now it's starting to happen everywhere at once. All the mechanisms of the immune system have evolved to handle infections, work against you. And the virus continues to spread and finally begins to infect more and more body cells, while the body desperately struggles to stay alive. In a desperate last effort to turn the tide, the immune system launches a cytokine storm. So, a cytokine storm is an SOS signal that causes the immune system to launch all of its weapons all at once in a desperate kamikaze attack. So, this hurts the virus but leaves behind tons of collateral damage, especially in the blood vessels. So, paradoxically, the healthier the immune system, the more damage it can do itself. More and more fluid leaves the bloodstream. Blood pours after every opening of the body and you become seriously dehydrated. That just not now blood left to supply the organs with oxygen and cells begin to die. If you reach this point, the chance of you dying is very high. And currently 6 out of 10 infected die from Ebola. So wow, Ebola is nasty, so it's time to panic, right? No, not even once. So the severity of Ebola gets papers sold and YouTube videos shared, so everybody's talking about Ebola. But currently the only way to get infected by Ebola is to come into contact with the body fluids of a person who shows symptoms or from infected bat. So just don't do that. Ebola has killed 5,000 people since June 2014, and a common flu kills to 500,000 people each year. Malaria causes up to 1 million each year and 3,000 people every single day, 10 children since this video started. So even if Ebola is terrible and scary, don't let yourself be scared. And the most infectious thing about Ebola is the media hype around it. And you could learn a bit more. So I discussed that Ebola is a virus that causes sporadic outbreaks in Africa, and that in between outbreaks it hangs out in a non-human reservoir. That there is a strong evidence that is reservoir is bats, and the virus continues to replicate within the bat population in something called the zootic cycle, meaning this is its native or baseline host. Occasionally, when either general conditions are right or as a consequence of two other animals such as non-human primates, and it can replicate within these other animals and jump back and forth between bats in something called the episodic cycle. And meaning these are not the typical host for the virus, and the episodic cycle can also involve humans either directly from bats or from primates, or most commonly from other people. So in case of Ebola, how exactly does the transmission occur? There are two proven modes of transmission. Over 99% of cases between people are transmitted through direct contact of broken skin or mucous membranes when affected body fluids, which can be just about anything. Blood, feces, and vomit are believed to the most infectious, but Ebola can also be spread via urine, semen, saliva, and breast milk. For example, a patient suffering at home with the undiagnosed Ebola vomits on themselves, their spouse, or other family members help to clean them up, and with hands soiled with the vomitus, even trace amounts of it, rub their nose or their eyes. That virus can sneak in through imperceptibly small breaks in the skin of the hands that a person might not even realize are there. In addition to this mode, a tiny fraction of healthcare workers have been infected by breathing in aerosolized, which specifically create large amounts of aerosolized respiratory secretions. So this would include bronchoscopy, sputum induction to obtain a respiratory culture, and potentially deep respiratory sanctioning. That is not the same as stating the Ebola virus is airborne in general, which is not. So in addition to providing modes of transmission, there are also suspected modes of transmission. That this includes direct contact of broken skin or mucous membranes with sweat or with contaminated surfaces. For example, a person with Ebola is sweating profusely from a high fever and grabs the door handle several minutes, and later another person grabs that door handle and before washing his or her hands, rubs the nose, her eyes. That has not been proven to happen, but infectious disease experts contrasted with modes of transmission. So neither observed or nor suspected. There are two main ones. First, airborne transmission outside of medical procedures. So you will not catch Ebola by simply walking past a patient in the hallway, provided you don't touch that person's body fluids, or any objects that person has also touched. Another mode of transmission which has not been observed is transmission via mosquitoes and ticks. Unlike some other viruses, Ebola is incapable of surviving in blood-sucking insects. So a few more important points about transmission: patients with Ebola have only been observed to be contagious once they are symptomatic. This is a key factor and explains why asymptomatic Ebola contacts can continue working and interacting in their community. So I wouldn't necessarily get on an 8-hour plane ride as an asymptomatic contact in the event symptoms on board develop, but contacts do not need to share themselves in at home. Next, just to emphasize again, Ebola is not airborne finally, and this will likely to be a surprise to most of you, but the maximum possible incubation period for Ebola is calculated to be about 25 days, which is obviously longer than the 21-day cut-off the CDC and the public health officials discussed in the media and reportedly used in practice. Here's a graph showing the distribution of the duration of the incubation period among patients with Ebola. So you can see that the most common incubation period is 5 days, with an average in the 6 to 10-day range, but there is a very long tail extending out to 25 days, and these cases Here it seemed like they would missed by the 21-day quarantine duration, and I have no idea why the CDC uses 21 days instead of 25 days. So I've sent them and read a clarification, and I will include an annotation later. So moving on, how does Ebola present? This is what symptoms to patients show up to hospital. Ebola usually has a very abrupt onset, with initial symptoms being fever, myalgias, sore throats, and although not shown in the picture, chest pain as I showed on the past. So past explanation is only present in about 90% of patients. It is not universal after several days of the early symptoms, and most patients will go on to develop GI symptoms such as vomiting and diarrhea, and along with rash. Most patients also develop mild bleeding problems, with only the minority developing severe hemorrhaging. Common lab findings of Ebola include panitopenia, elevated transaminases, elevated test of coagulation, which will often progress to DIC, and proteinuria, which can progress to renal failure in patients who succumb to the illness. Death is usually from a combination of septic and hypothalamic shock when it comes to the non-specific nature of the presentation, particularly in its initial stage of Ebola. So, Ebola superficially looks like many other diseases, and these most obviously include other viral hemorrhagic fevers such as the Marburg, Lassa, dengue, yellow fever, and literally dozens of others. It also includes many other diseases such as malaria, typhoid, and taro hemorrhagic E. coli, meningococcemia, and influenza. It even looks similar to non-infectious conditions as well, as such the hemolytic uremic syndrome in thrombocytopenic purpura, along with acute leukemia. So how in the world does a doctor or nurse figure out whether to be concerned about Ebola? So it comes down is to travel and contact history. This is the most essential component of suspecting and diagnosing Ebola. So it is extremely improbable that an individual with symptoms and signs of Ebola actually has Ebola unless one of the following occurred within the preceding 21 to arguably 25 days travel through an area currently affected by Ebola epidemic, direct physical contact with bats, rodents, or primates in an area where Ebola is thought to be endemic. So within the bat population, or direct physical contact with a patient actively suffering from Ebola. Once again, if one of those three criteria are not met, a patient with symptoms of Ebola is highly unlikely to actually have Ebola. So when it comes to diagnosis is confirmed by detecting Ebola RNA. So sequences in blood using a test called reverse transcriptase PCR. So this test is believed to be both highly sensitive and highly specific, where this and highly specific when performed between days 3 and 10 instead of RT-PCR. Antibody testing can also be performed. This is helpful when either investigating a diagnosis in a patient with a high pretest probability of Ebola, but negative RT-PCR diagnosing a case outside of that day 3 to window 10 or identifying prior Ebola exposure in a patient na recovered. How about treatment? Where do we stand with that? Well, currently the standard of care for Ebola is a supportive treatment. That means things like IV fluids to treat, dehydration, conventional transfusions, if anemic base oppressions to improve low blood pressure and correction of electrolyte abnormalities. All other forms of treatment which are more specific are best considered. So experimental at this point. These other treatments include antibody preparations. The low-tech version of this simply to transfuse either whole blood or plasma from people who have survived infection. The idea is that if you survived Ebola, your immune system must have developed a ton of anti-Ebola antibodies, which should work almost as well and transfused into somebody else as they did in the donor's illness. Although there is a fair amount of logic to this approach, and this has been done for Ebola both in Africa and the US, it remains an unproven treatment the high-tech version of antibodies are lab created monoclonal antibodies, monoclonal diseases such as infliximab, also known as the remixade, which is used to treat rheumatoid arthritis and inflammatory bowel disease. One experimental monoclonal antibody cocktail for Ebola that has been mentioned in the media is called the ZMapp, which to date has been given to 7 Ebola patients, 5 of whom recovered and survived this sample. It's far too small to justify bringing out the champagne yet, but it certainly seems promising. So unfortunately, ZMapp is extremely difficult to produce and the company has actually already ran out of drug. So after just those 7 doses in addition to antibodies, there have also been some sporadic use of antivirals, which include both medications intended specifically for Ebola as well as those originally designed and already used for other viruses, and none of these so far have been used on more than a tiny handful of Ebola patients, and their efficacy and even safety is far from proven. So in case you were thinking about getting an Ebola vaccine before your next trip to another country, so there's some bad news is none though several vaccines are currently in the clinical trials, and they're going to conclude that this brief discussion of infection control, since there are no proven effective treatments for Ebola. So controlling the epidemic is all about preventing new vaccines. So then there are 4 cornerstones. First, strict quarantine individuals with suspected or confirmed Ebola. Second, contact tracing. This refers to the process of tracking down any potential contacts of a patient who suspected were confirmed Ebola, checking those contacts for symptoms themselves, and if symptomatic, then tracking down all of their potential contacts. This is a very time and resource intensive process so much. So more so in Africa than in the US. Third, close monitoring for symptoms including but not limited to twice daily. So temperature checks in an individual who has been potentially exposed to Ebola. And last, proper use of personal protective equipment by healthcare workers. What form of personal protective equipment for or PPE should be used for me? Here is where I lost the CDC. And while treating Ebola patients, impermeable gown, eye protection, face mask, and gloves. In other words, that this doctor is wearing now. I don't know what you to see a patient Ebola, protect it like that seems quite cavalier. No protection for the hair, for the cheeks or the neck. No protection against fluid dropping down behind the face shield from above, and no coverings for the feet. Really has a bad protocol, luckily, and very long overdue. So the CDC released new much more robust guidelines, and they now recommend the combination of an impermeable gown, hood, some type of face, which may or may not be an N95 mask, usually reserved for suspected TB, double gloves, and leg and foot covers as it's being demonstrated in the picture PPE, and should be put on with assistance from another trained individual who should literally through a checklist to make sure everything is done properly. And some hospitals are even more robust with their PP and use personal respirators with or without positive pressure suits. So, but this is not currently considered standard practice outside of level 4 biohazard research labs. A few final points about infection control: and the medical facility should keep a log of anyone entering the room for a patient quarantine for Ebola, and all medical equipment including linens and mattresses should be disposable. Whenever possible, use of needles and other sharps should be minimized. So aerosol generating procedures such as bronchoscopy or sputum induction should be avoided. And in the event that a patient dies, remember that their body remains contagious, so possibly indefinitely. The typical recommendation is to cremate the remains of an Ebola and be safe, provided that coffin is completely sealed. The preparation and burial is performed by trained personnel, and there is no chance the body will be excused. So that's it for this video presentation. So later I will proceed to the understanding on how really Ebola affects the individuals. What is Ebola? Ebola is a virus. A virus is something that enters our bodies, making us sick. Most viruses attack just part of your body, like a stomach bug, which infects your stomach and intestines, or the flu, which infects your throat, nose, and the lungs. After a few days, the body usually fights off these viruses, and you start to feel better. The Ebola virus is much more dangerous because it spreads all over the body. It infects the blood, which carries it to all the organs, including the liver, heart, kidneys, and the lungs. As it spreads, it gets stronger and produces even more virus. And within just 5 to 10 days after feeling sick, the organs may start to fail. So if you feel sick, the faster you find out the cause of your illness, the faster you can get the right medical care, and the better your chance of becoming healthy again. What are the symptoms of Ebola? After the Ebola virus first enters a person's body, they don't get sick right away. The viral levels are so low that a person does not have symptoms and cannot spread the virus to others. Then suddenly, between 2 and 21 days after infection, the virus starts to multiply rapidly. Now the person feels sick and can begin to spread Ebola to others. Remember, a person without symptoms is not infectious. Only a person with symptoms like a fever can spread the virus. A person might feel tired, too hot or too cold, have headaches, joint and muscle pain, a sore throat, and a lack of appetite. As the Ebola virus spreads throughout the body, a person might experience a rash, stomach pain, nausea and vomiting, and diarrhea. Once the virus is spread throughout the entire body, some people may have bleeding from the eyes, nose, gums, or other body openings. As the infection grows stronger and more virus is produced, the person may become very weak, quiet and tired, and appear less aware of what's happening around them. Most people with Ebola will die if they do not get medical care. But people who are cared for at an Ebola treatment center have the best chance of clearing the Ebola virus from their body and recovering. This is why it's important to recognize symptoms, notify health services early, and teach others to look out for the symptoms of Ebola too. How do you prevent Ebola? If a person has a fever and other symptoms of Ebola, it is important not to touch, hug, have sex with, or share food or drink until the sick person has been examined by a healthcare worker. This is because the Ebola virus is present in the blood, saliva, mucus, stool, vomit, urine, sweat, tears, male and female sex fluids, and breast milk of an infected person, even after a person has died from Ebola. You can get Ebola when infected body fluids gets in even the tiniest break or scratch on your skin. You can also get it by touching the infected fluid and later rubbing your mouth, nose, or eyes. You can get Ebola virus through the air, but it can be found in infected fluid that has dried on surfaces, such as clothing, bedding, furniture, or the floor, as well as doorknobs, light switches, and mobile phones. It is important to wash your hands often with soap and water, especially after you use the toilet and before you cook or eat. Also, do not share razors or needles. Bush meat is very tasty, but because bush animals can also get Ebola, which can spread to people and spark new outbreaks. It is illegal in many countries. Anyone touching a dead animal in the bush or hunting, butchering, or preparing bush meat can get Ebola through cuts or scratches on their skin or by eating the meat. So it's best to seek out safer sources of meat. If If a loved one dies at home during the time of an Ebola outbreak, do not touch, wash, or kiss the body. And do not touch the belongings or surroundings of the dead person. The house should be closed, and family or neighbors should immediately notify the nearest health facility or call the Ebola hotline to arrange for a safe burial and cleansing of the home. Always tell the truth to health workers if you have been to Ebola hot zones, been around a sick person, or have been to a funeral in the past 21 days. If a person has been in contact with someone with Ebola, officials will follow up daily for the next 21 days, so that should they become ill, they can be transferred to an Ebola treatment center and be tested and cared of. Like many viruses, Ebola thrives when people spread it without knowing it. It only takes one person to infect an entire family or a village and beyond. Working together, communities that understand the facts about Ebola can stop its spread and saves lives. How is Ebola treated? Getting treatment early greatly increases the chances of surviving an Ebola infection. Do not try to self-treat, as this just gives Ebola more time to weaken the body and spread to others. If you have flu-like symptoms such as fever, chills, or muscle or joint pains, headache, tiredness, sore throat, or lack of appetite, call the hotline for advice or go to your nearest health facility right away to find out if you might have Ebola or another disease which needs treatment. If the symptoms are worse so that you are very weak, have stomach pain, of vomiting, diarrhea, or bleeding, either call the hotline to check if you need an ambulance or ask the community health leader to call for assistance. While you wait for the health services, place the person alone in a separate room, but do not try to treat them yourself. You can help by giving them clean drinking water and food such as fresh fruit, as long as you don't touch the sick person. Do not try to clean up any body fluids such as vomit or diarrhea that came from them. When the health services arrive, they will be wearing protective equipment like goggles, masks, and gloves. They will remember that underneath that scary-looking protective gear is someone there to help. They will take the sick person to the Ebola treatment center where they can care for them and help them survive. Specialists will come to clean the home and whether else the sick person spend time to remove the virus. They may burn the patient's clothes to stop the virus from staying in the house. All these precautions will help protect your family and community. At the Ebola treatment center, you will be given the best medical help available in your area. They will examine you and run tests to find out why you are sick, if you have malaria, typhoid fever, or another disease. Any necessary treatment will be arranged. If the test shows you have the Ebola virus, highly trained doctors and nurses will provide round-the-clock care to help you keep fluid in your body and relieve symptoms, and help your body fight the infection. Plenty of food and drink will be provided to keep up your strength and give the best chance of survival. If a person dies from Ebola, the staff will carefully wash the body with chlorine and water. Then the body is placed in a special bag which prevents body fluids from escaping. This is necessary to keep the community safe because when a person dies from Ebola, the virus remains active and still very easily spread to people. The family may come to see the body before the burial. The body will be transported to a cemetery and buried in a secure way, where the family may organize prayers or other spiritual rites. Death or recovery from Ebola takes place about 10 to 14 days after symptoms start. So recovery occurs in those people whose bodies are able to fight the virus until it disappears from their body. Their Ebola tests become negative. They are no longer contagious and they can safely return to home. However, men might still have some of the virus present in their semen for the next 3 months. So it's especially important that they wear a condom during this time. Welcome your loved ones back into the community and celebrate their recovery. By working together and sharing information about the disease, we can stop Ebola.